Hey, this is Dr. Chris Nelson, and right now I'm going to do another treatment planning session, and we're going to review an interesting case that at first glance looks like there's not a lot going on, and after we dive into it, we'll see that there are actually a couple things we'd want to discuss with the patient and get their opinion about how they want to move forward. So let's take a look at this patient. Let's go ahead and hit the record button starting in 3, 2, 1. Okay, so here we go. We're going to start on the first slide. We do these new patient consultations for every new patient, and it's a good way to establish a good relationship and also a very thorough baseline on what the patient needs, but also wants and is interested in. So if we go ahead and take a look at this, we'll see that the patient has a nice smile, and we have the upper occlusal, lower occlusal view, a retracted view, and smile picture. A lot of times this smile picture is actually a crop from the portrait. We're using a pretty high resolution camera, so that crop is good, and usually we'll get a more natural smile from the portrait than the other pictures. So anyways, we're looking here. We're going to start with the observation list. The observations, we have tooth position and shape. The patient has like a pretty typical class 1 occlusion, some crowding on the lower anteriors. A lot of times that's an orthodontic relapse issue, like patient didn't wear their retainers, sort of situation. And tooth issues, there isn't really any decay present, although there's tooth number 5 has a very deep existing composite filling that's super close to the nerve. Tooth number 8, and this is why the patient came in, tooth number 9, but tooth number 8 and 9 have some composite bonding on the mesiofacial on 8, and tooth number 9 has kind of some all surface cosmetic composite bonding. If we look at the x-rays here, you'll see that there's some poor margins, so the composite actually kind of flares out at the gums. Those composites are really hard to do, and they're really hard to do well. It takes a lot of repetitions to do a really good job at gum line tooth decay fillings, okay, gum line fillings. So anyways, that's why the patient came in, tooth number 9. She was feeling like the filling was loose, and indeed it was loose. And so we're definitely going to be talking a lot about that. But you can also see here, tooth number 5, man, this existing restoration is like on top of the nerve, according to this bite wing x-ray. So tooth number 15 has a possible bubble in the composite. Let's add the teeth numbers here. 8, number 9. Usually we have the teeth numbers added already, but we're going to do this live so you can see the behind the scenes. And let's just go like that. All right, anyways, tooth number 15 over here has a possible bubble in the composite. That's kind of an interesting, I like to point out that sort of stuff on the radiographs, at least to mark it, just in case if the patient called in and said, oh, I had some issue. Well, maybe it's already marked on the x-ray and we can kind of help them faster over the phone if we, or you know, in the case of tooth number 5, if they called in, oh my gosh, upper right, I'm having some significant pain. It might be number 5. So anyways, number 15 has a little air bubble in the filling, I think. It's not a big deal, but I wanted to mention it. Tooth number 18 and 19 have gum line fillings. And there's like a dark spot on the margin. The margin is where the filling material meets the tooth. And so number 18 and 19, we'll talk about that with the patient. Let's add a tooth number here again. I hope that you're finding this video and you're kind of learning either about treatment planning as a dental student or another dentist. You can see how we do our new patient process. We do this for every new patient, or you're just somebody who wants to learn about teeth, and then if you're a dentist and you think that this is a waste of time, or you have a different way of doing things, I'd love to hear about it, because this process is developed out of like what my dad did, what my grandpa did, and kind of is an evolution of that. So anyways, tooth number 15, we mentioned tooth number 18, they have gum line fillings. You can see them on the x-ray. They're kind of sizable fillings on the side of the tooth, and they're more visible on our 3D scan. So, you know, I mentioned that one of them has some stain, has some rough margins, so it's just kind of not polished very well. And then another one, tooth number 29, we mentioned has some rough margins. So there aren't any infections. There's not really much recession at this point. Maybe a little bit of generalized recession, but not too bad. And then there are wisdom teeth missing. The gums are overall in a healthy condition, and except for there's some deeper pockets around number 30 and 31. I think it's related to all the restorative work that's been done down there. But it could just be missing that area with oral hygiene. The smile concerns, we're talking about number 8 and 9, those top 2 teeth, the patient really is concerned about those. So what is our plan? Well, our plan is, the top section is about keeping your teeth for a really long time. So we have routine cleanings twice a year, regular checkup visits 1 time a year during the cleaning visits. So I'll come in and check everything. And then fluoride varnishes. So we are a fluoride friendly office, and the fluoride helps any little spots that could be early cavities or issues. It helps with that, so you won't need as much dental work. Sonicare toothbrush. We are a big fan of the electric toothbrush, Sonicare specifically. Two-way toothbrushing is a strategy for oral hygiene. I have a separate video on that. Here's a QR code here, but you should check that out if you haven't seen that video. It's if you don't want any cavities, two-way toothbrushing. And then daily flossing, tongue scraper. Tongue scrapers are great. Carie-free treatment rinse. That is a 2-bottle rinse that you mix together and you swish with it, and it helps a lot with bad breath and bacteria buildup. And then step 1, discuss how much of a change do we want with your smile. Now look, this patient, we could go crazy and we could do composite veneers, we could do actual veneers, we could do crowns, we could do gingival repositioning, so we could lengthen the teeth, we could lengthen the lip, we could do all these things. But if the patient likes her smile, why are we doing that? So I always like to leave that up to the patient. If she's coming in and saying, just fix my front tooth, we can just fix the front tooth. But if we want to do something bigger, we can do something bigger too. So I like to say, discuss how much of a change you want with your smile. Do we want to just do a repair, or do we want to make a big change? I think she's going to say we just want to do a repair. Discuss at home whitening before any composite work. We've actually already ordered whitening trays based off of our exam. I think she said, go ahead and send them. So we sent our 3D scans to one of our labs to make whitening trays. So I think they're already here in the office. Step 2, replace the fillings. Number 8, I may or may not replace those fillings. It depends on what they look like when I am working on number 9. So number 9, I'm going to take apart those existing fillings, remove all the parts that don't fit very well, and do an expert job at replacing those fillings. So that's step 2, but it's really kind of a step 1B. And then smooth number 18 and 19 and 29. So those margins, if I can smooth them to get some more life out of those composite fillings, I will. A lot of times I find on those gum line fillings, if they just aren't perfectly finished, then they just need some smoothing to take care of them. And then step 3, monitor the lower right. Those periodontal pockets are a little bit deeper. If we look at our probes, we've got some 4s, 5s, and some bleeding on the lower right. So we'll keep an eye on that with our hygiene team. And then in-house orthodontics, if they're interested, or we can work with an orthodontist. The in-house ortho thing is a thing that I only tackle really easy cases, and the patients need to understand that there's a screening process prior, and they may even end up at an orthodontist anyways. So we love our orthodontists. So, and then number 5 and 18 and 19, anything with a large restoration, I like to put some fine print in there that, you know, sometimes they can be a problem later. They might need a root canal or even some other work. We have a page here about expectations versus reality, so I'm not going to go over that in this video. and then our welcome letter with the two-way toothbrushing. So that's about it for this patient. As you can see at first glance, it doesn't look like a big deal. Maybe you're also mentioning tooth number 6, there's some gum line staining. We might talk about that too. But the consultation visit gives the patient a chance, the patient and I, a chance to sit down and go over stuff one more time before we do anything at all. So thanks for watching. I hope you enjoyed the video, and we'll see you in the next one.